Total 28 volunteers aged between 20 to 45 were enrolled, who have bilateral symmetric masseter muscle with width of 3 to 5 centimeters when they chew. We excluded the smaller than the width of 3 centimeters. And we inject the botulinum toxin at 4 points. I take the upper border at virtual line starting from tragus to mouse corner, approximately the half of the masseter muscle from zygomatic arch to mandible angle. And from 1 centimeter apart from each border, upper and anterior and posterior, lower, I inject deeply into the muscle. And each point I injected 0.25 mil per site. Altogether, we injected 1 mil per site, irrespective of dose, 20, 30, 40 units. It means the dilution was different. But the injectors, doctors didn't know which syringe is 20 or 30, because double-blinded. As a primary efficacy measurement, we checked the volume reduction of masseter muscle with CT after 12 weeks injection. And as you know, in the face, the most important factor to make the face angulated or square face is the lower half of masseter muscle around the angle of mandible. So we checked also the lower half volume of masseter muscle. And as secondary efficacy measurement, we, for investigators, assess the grading according to clinical photograph. And also, we performed self-assessment according to evaluation grade like this. We checked also adverse events such as muscle weakness, facial expression change, etc. We performed statistical procedure as follows. Now, I will show some results after botulinum toxin for masseter muscle. Right is 30 unit, left is 20 unit. As you can see the CT data, you can see the marked improvement, marked reduction of masseter muscle. In the side of 30 unit, 21% reduction was observed, while inside with 20, 15% reduction was shown. Regarding the change of lower half, we could observe 22% reduction in 30 unit, while 18% in 20 unit. You can see the marked improvement of masseter muscle to make her look slender than before. In this lady, she received 20 unit in right side where you can notice the 33% reduction, while the 43% in lower half. In left side, where 30 unit was injected, showed similar data, 33% reduction. This is similar results you can see. This is a high dose group, 30 unit, 40 unit combination. In right side, where 30 unit was injected, we could observe 35% reduction, and 60% reduction was observed in 40 unit. As you can see here, this 20-30 unit combination, we could get similar results between two doses. Even in lower half, we could get similar results. This is 30 to 40 unit combination. Even though a little more reduction was observed in higher dose, in 40 unit, but statistically, we could not draw any meaning. This is overall comparison between 20, 30, and 40. We could not find any dose-response relationship between 20, 30, 40 units. This is the results of self-assessment. It's improved with times. Similar results we could get from the investigators' assessment using clinical photographs. As you see here, 3 months later, we could get maximum effect of this treatment. As adverse effects, we got some muscle weakness in low dose group 4, 5 in higher dose group. And prominent zygomatic arch due to the sunken cheek was observed in 1 in low dose group, while 2 with high dose group. And in 1 volunteer showed facial expression change when smiling like this. She cannot fully smile. And we could observe muscle bulging when chewing at 1 person. However, we could not find any statistical differences of adverse effects between different doses. So in terms of efficacy, we could not find any significant differences between 3 different doses of Neuronox, 20, 30, 40. And regarding the side effects, muscle weakness is more in higher doses, but it doesn't have any statistical meaning. As a conclusion, all 3 doses show similar results. So we think, as a conclusion, 20 unit Neuronox is sufficient for the improvement of scare face in Asian women in terms of efficacy and safety. Now I'm going to the last one, because comparing with Professor He, I have to cover 3 clinical studies. I must hurry up, sorry. Well, multiple intradermal injection of botulinum toxin is widely used in Asian area under the name of mesobotox, dermatoxin, or Botox lift, for the purpose of not only removal of facial dynamic wrinkles, but also so-called facial lifting effect, when we expect lifted face, rejuvenated face, which improves elasticity of skin and reduces pore size and static wrinkles also. However, there were sparse reports of objective research on this theme. So we'd like to know elucidate the effect of multiple intradermal injection on skin using non-invasive techniques. All 24 healthy females were enrolled. As the previous slides, previous clinical studies, we performed intra-individual comparison study. At one side of cheek, we injected all 15 units of botulinum toxin Neuronox, total 15 units in 30 points. As a control, we injected normal saline at the other side of face. Of course, the side was randomly assigned. We utilized the non-invasive instrument like this for this replica depths. Using the visiometer, we measure the replica depth for static wrinkle depth, and cutometer for elasticity and sebum expression, hydration, pore size, and skin thickness as well. And also we assessed the photograph. We performed the statistical analysis as follows. Now I'll show you the results. We could get significant positive data in the improvement of static wrinkle depth. As you see here, the one parameter the represented parameter for depth of static wrinkle, R3 was improved by 20% at 12 weeks compared with control. And all other parameters showed a similar statistical different data compared to control. However, other parameters, including elasticity and hydration, sebum, pore size, and skin thickness, did not show any positive data. This is clinician's photograph score. As you see here, we could observe the statistical significant improvement in the treated side than placebo side. As you see here, this is before. And 4 weeks after botulinum toxin was injected, as you can see the improvement of static wrinkles, not dynamic wrinkles. As usually, we can expect the improvement of dynamic wrinkles when you do botulinum toxin. But botulinum toxin can improve the static wrinkles like this using this method. Compared with the control side, you cannot see any improvement of static wrinkles. Patients' satisfaction was statistically significantly improved at during 12 weeks after injection. We could not find any significant adverse effects from this study. We think our study's first report to measure and analyze the effect of multiple intradermal injection on skin using objective non-invasive instrument. However, we could only prove the limited effect of this novel technique for static wrinkle reduction as opposed to conventional concept where MIDIP improves skin elasticity, skin thickness, hydration, even reduction of pore size, reduction in sebum secretion. As a hypothesis, why the static wrinkles would be improved by the botulinum toxin, my hypothesis is a kind of lymphatic insufficiency may happen. If we inject botulinum toxin, then as a result, some mild edema will happen, which can bring about such a improvement of static wrinkles. This is my hypothesis. Lastly, I will summarize the effect of mesobotox dermatoxin of this MIDIP novel technique. I think this technique has 3 effects. The first one is wrinkle reduction. And the second one is change of appearance. As I already mentioned in the second clinical study, we can make the face smaller than before. After injection into masseter, injection into temporalis, you can make the face smaller and look lifted. And if you inject only central part here, rather than lateral part of frontalis muscles, then the lateral part of frontalis muscles where botulinum toxin is not injected moves more than lifted the lateral part of eyebrow, which makes the face look lifted. So this is a change of appearance. And last one we could expect from this technique is the improvement of skin texture. So where we could expect pore size reduction and static wrinkle reduction and skin thickness or etc. But in this study, we conclude that only static wrinkles could be improved by this technique in terms of skin improvement. Thank you.